You're listening to the Dr. Shoup Show. We do dental differently. Must not miss information is online at ddsradio.com.
Good to have you here. I really appreciate it. Thank you very much. And we're going to cover a topic that came to me via you, my listeners. You went to the website. You gave me suggestions about things that were important to you. And I will tell you, I feel a sense of guilt here that I have been remiss in not having covered this topic earlier. And the topic is: be true to your teeth or they will be false to you, false teeth. And we're going to be talking about dentures, full, upper, and lower, where somebody has no teeth at all whatsoever. And we're also going to be talking about what are called partial, or partial plates, where you have a few teeth in there, but the dentist has made a metallic framework that has some plastic teeth placed on it, and it comes in and out. Traditionally, these things have the little hooks and clasps around the teeth, and sometimes you can see them, sometimes you can't, but that's what we're going to be talking about. And coincidentally, it came across my desk from the Journal of Dental Research, and they just, in their latest edition in October, the headline reads this: seniors should remove dentures at bedtime. Seniors who wear their dentures when they sleep are at increased risk for pneumonia, according to this new research. The study included 524 men and women. Average age was 88, who were followed for 3 years. Now, you and I have talked before. When you read about studies, you want to read about how many people, what's the cohort, how many people are in the study. And 524, that's a pretty good number. That's an appreciable. You can get good data from that. And you want to think about what is the length of time that they've been studying this particular issue that they want to look at. And this one is 3 years. That's phenomenal. That's amazingly great. So this is a very reliable study. Among the 453 denture wearers in that group, the 41% who wore their dentures when they slept were about twice as likely to develop pneumonia as those who removed their dentures or partials at night, according to this is the Nihon University School of Dentistry in Japan. The researchers also found that seniors who wore their dentures while sleeping were more likely to have problems such as tongue and denture plaque and gum inflammation, according to the study. The implications are really straightforward and clear, according to the researchers. They said seniors should be told not to wear their dentures while they sleep. So this study came across my desk, just coincidental to the fact that you all wanted me to talk about dentures. So here we go. We're in Dental School 101. We're all sitting in class. The professor is at the chalkboard, and here we go. Here's what the deal is. When you have plastic teeth in your mouth, they have a significantly different surface texture than either your gums or your cheeks inside your skin or your teeth. They tend to accumulate bacteria significantly faster, and the bacteria sticks to a denture or denture teeth or the metal of your partial more tenaciously than it sticks to any part of your natural body. So what you get is the bacteria gets lopped onto these dentures and partials, and it will not give up. It stays stuck. And so as the little bacteria are stuck to your denture, your upper or your lower or your partial, then it calls all of its buddies and says, hey, I found a really great place to live. Come on over here. It's warm. It's wet. It's wonderful. You'll love it. Come on down. So that is the genesis of the problem. You're listening to the Dr. Randy Shoup Show. I am your host, Dr. Randy Shoup. And we're talking about dentures. We're talking about partials. We're talking about should you wear them at night or should you not? And so that's the biggest thing. The dentures have a completely different sort of texture. So it accumulates a lot of this plaque and bacteria. Now, Mother Nature has designed us to do things well. One of the things is that we have a tongue that, although it maybe doesn't look like it, it is relatively raspy and abrasive on the top surface. We have teeth that have bumps and grooves and abrasive qualities to them on the biting surface. We have lips that move around and scrape against our teeth. Our mouths are designed to be, to some degree, self-cleansing, okay? And so we, during the day, as we eat food, food has coarseness to it. If you eat coarse bread, if you eat salad, if you eat anything that has any potato chips, anything that has an edge to it, those things tend to scrape away this bacteria that accumulates on your mouth. And so your mouths are designed to have time, needing time for all of your parts to rub together because it cleanses itself. If you put a denture, full upper denture or full lower denture or a partial in your mouth and leave it there, then it covers over a whole bunch of real estate in there that normally gets cleaned off, but the real estate that it covers doesn't. For example, the entire roof of your mouth, all of your gums, and then your cheeks and your skin and your tongue lay up against the side of this thing that just has an absolutely remarkable coating of plaque and bacteria on it. So what happens is we get this massive accumulation of little biological critters, and guess what? Some of them cause disease. And in the elderly who have a suppressed immune system, we see from this data that I shared with you that these folks, when you suck in the right kind of bacteria, guess what? You get pneumonia because you have this little greenhouse in your mouth that's constantly making bad bugs that you are inhaling and you are swallowing, and lo and behold, guess what? You get sick. So I'm going to tell you how to avoid that. You're listening to the Dr. Randy Shoup Show. I am your host, Dr. Randy Shoup. We're talking about dentures and partials, and we've already established that you do not, preferably you do not, want to sleep all night with a upper or lower denture in or a partial. Now, I will tell you, I have several patients that will look me dead square in the eye and tell me that on no uncertain terms will they even entertain the idea of ever being without their teeth. Their significant other spouse, and this is an amazing display of will. I'm not kidding you. I'm not joking a minute here. Their spouse, significant other, in numerous occasions, has never seen them without their false teeth in. I have many women patients whose husbands have never seen them without teeth, and they will not be seen without their teeth. I have many men patients who say, on the down low, quiet, doc, off to the side, look, man, I'm not going to take these out. Nobody is going to see me without my teeth. That's all there is to it. What do I do? So here's the trick. Here's what you need to do. If you can take your dentures out at night or your partial out at night, here's what you do. I want you to take a regular toothbrush with baking soda on it and brush your gums, brush the roof of your mouth, brush your tongue, brush your cheeks, brush everything that's in there with simply that baking soda solution that we've told you about, where you can go to the website at ddsradio.com. The formula, it's a magical secret in formula. It's baking soda and water, okay? It's if you need help with it, call me. I'll be happy to help. But you make this paste, this slurry, and that's what you use. You spit that out. Then you can take a mouthwash of your choice. I don't care if it's Listerine, Livorus, whatever it is, alcohol, non-alcohol, doesn't really matter. But you can take mouthwash then and swish your mouth around real thoroughly, spit it all out, go to bed. Your mouth is clean, everything is good. For your dentures, I want you to do exactly the same thing. You can go out and buy expensive cleaners and soaking agents and all this kind of exotic stuff if you wish. Perfectly fine. No problems with that whatsoever. Follow the instructions on the Efferdent or follow the instructions on the Polident, cleanser stuff. Help yourself. But if you want to simplify the world, take the toothbrush that you just used on your mouth and attack your dentures with it with the same baking soda solution that you just made, and then splash mouthwash on them, rinse the mouthwash off. Do not, I repeat, do not soak your dentures, your removable anything, upper denture, lower denture, partial, I don't care. Do not soak it in mouthwash. It will ruin it faster than you can swim. Unbelievable. It will destroy a denture or a partial. Do not soak them. Rinse them off. Let them sit on the countertop. They're doing fine. If you insist on wearing them at night, right before you go to bed, take everything out and do exactly what I just told you. Baking soda, mouthwash, baking soda on the denture, mouthwash, put everything back in, go to bed. And then in the morning when you get up, do exactly the same thing again. Baking soda mouthwash in your mouth, baking soda mouthwash on the denture, put everything back in, go attack the day, carpe diem. So that's what you need to know, and you won't get pneumonia, and you'll be healthy, and you'll look nice, and it'll be all terrific. Now, okay.
You're listening to The Dr. Shoup Show. Exclusive insider info, audio, and video is online now at ddsradio.com.